Well, the pharmacy profession has changed through the years. In the 1930s, it was known as compounding pharmacy.
Yeah, drug manufacturing altered the way pharmacists dispense medicine, and until now, Paxton is home now to a compounding pharmacy, which is awesome. Doug Higgins is the pharmacist and owner of Doug's Compounding Pharmacy. So, all right, so the first question, what is a compounding pharmacy?
Well, compounding pharmacy is a pharmacy where we actually prepare the medications. The doses are unique to each person, and we try to make a medication to match the person.
Oh, so it's kind of like the descendant of apothecaries.
That's correct.
Yeah, okay, very cool.
So what makes you different from other pharmacies? If I wanted to call in my prescription, why would I pick a compounding pharmacy? Yeah.
Well, we like I mentioned earlier, we have the medications are unique to each person, and we use medications that are typically not commercially available. It might be something that there's a dye in a medication that you're allergic to, lactose or gluten, things of that nature.
Yeah, and there can be things even in the little caplets that traditionally hold the medications, right, that you have to be aware of. So, and that's something that if you talk to someone like Doug, you can find out.
We have one lady who receives a capsule that's vegetarian because she can't use the capsules that come from gelatin.
Huh.
That's really interesting. Let's take a tour inside your facility. It's a little different than what you expect when you go to some of the other pharmacies.
That's correct. It's very different.
Yeah, let's tell me a little bit about what's different inside.
Well, when you first walk in, you'll see a large window that shows our lab where we prepare the medications. So we have chemicals, we have specialized equipment where we process, we mix the creams and ointments, we make capsules. Like right here, we can see one of our technicians weighing and preparing the medications. So it's completely different than what you would see normally. You can see the special protective wear that each technician wears in the lab. So it's quite different than what you would normally see.
It's so authentic, which I love that too. And again, like you said, one of the important things here is the fact that if you have a special need with your medication in particular, you can do that. And you actually make other things too, in-house, right? You were telling me a little bit earlier.
So many of the different types of things we do, we have pain creams that you can rub on your skin. We have specialized oral pain medications that we can prepare. We have a lot of hormones that we work with, so we prepare hormones for men and women. Huh. And so many times the hormones are very important to the quality of someone's life. We work with veterinary medications. We work with a special migraine medicine that can be rubbed on the back of the neck instead of swallowed. So many, you know, how many people have migraines?
Okay, now do we need to have a prescription for that, or is that something we can come in and say, oh my word, I've got the worst migraine, what can you do to help me? And you can whip something up?
All the medications that we prepare, or compound is the correct term, all the medications we compound are prescription.
Okay. Now, you're speaking about hormones a little bit earlier, but the age limit is not really a limitation on those hormone replacement therapies, correct?
No, hormones are wonderful for many age groups. For instance, with women, their hormone levels start to change at approximately age 35. And throughout life, hormones can be very valuable.
For men or women.
For men or women. And we know that for the women, they can feel so much better, but we need to use the right hormones. And we use the hormones your body makes. They're identical to what your body makes.
That's interesting.
So, yeah, I was going to say, are you going to ask the same question about insurance?
Yes.
Okay, yeah, like so insurance is such a big issue. How do you deal with that, and can people use your services through their insurance?
Most insurances will cover the compounded medications. There's always exceptions to these things.
Yeah.
But we would always evaluate that for you. We would find out your insurance, and we would see if it's covered, what your copay would be, and then give you that answer before you would agree to go ahead with a prescription.
What's on the dispensers here?
Well, the dispensers have creams in them. So this is an example. All three of these are measured dispensers. So if you were to pump the container with the lid off of it, the cream would come out in a measured dose. So we want you to use a certain amount of medication, and that's a way of measuring it, and it's easy and convenient.
Very cool. Okay, so I'm going to take a stab and guess that compound medicine isn't generic.
That's correct. It's not generic.
Okay.
Good to know. Good to know that too. And then obviously you have to have a relationship with doctors.
That's correct. That's one of our big One of the really important things we have to do is establish relationships with physicians so that they understand that there are alternatives for their patients. For example, the migraine medication we discussed is really very new, and we have to tell doctors about that.
Sure.
And we need to tell patients about that.
That's good. And the doctors have no problem working with you because you're a licensed pharmacy.
That's correct.
Yeah.
And we establish that relationship and that trust. Compounding is all about developing relationships and meeting patient needs, very specific needs.
Yeah, and you're in Paxton,
That's
so
correct.
people can find you there. There's not that many around in the area.
No.
You're one of the few.
That's correct.
Okay. Well, hey, we will get you connected with Doug Higgins, the pharmacist there.
Thanks.
And look, there's his website right there, which we'll also connect you with at ciliving.tv after today's show.
Doug
Thanks so
Higgins,
much.
yeah,
Yes.
interesting stuff. See how